So ladies and gentlemen, I welcome Professor Ian Cooper.
Thanks, Lindsay, and good morning, everybody. And indeed, it's a pleasure to welcome you here today, our 8th annual Rural Health Research Day. Just to know the time, don't get too anxious. I'm not going to use half an hour. That was planned in advance. Yeah, so it's really good to have you all here. We have close on 100 people who will be joining us today. Not everybody, as you can see, has arrived yet out of the 100. Some people will be moving in and out, but it's fantastic to have so many people. We will be having 4 plenary speakers, 19 parallel sessions, a workshop, 2 posters, so a good full day, and we're very excited about that. Special welcome to Dr. Lizette Phillips, Chief Director in Cape Winelands District. It's always wonderful to have our partners, and I know she's not the only one from our partners, but she represents them, is the head, and Lizette, your support of these activities is always much appreciated. So thank you. There are lots of other people we could welcome. I'm not going to go through a long list. I do want to say, though, I've lost her now in the audience. So there she is. Welcome, Susan van Skalkbeek, Director of the Centre for Health Professions Education. For some of our colleagues in the faculty, they don't know it's the main campus, so they didn't come today. No, you know, getting on the mountain for some people is a big journey. Also, very warm welcome to the people who are doing the plenary sessions and this morning, and most significantly to our keynote speaker, Dr. Nulda Beyers, whom Lindsay will introduce formally in a while, but thank you very much for coming and being with us this morning. Our other keynotes, thank you to our own Amy Slowgrove, to Dr. Sabella Petros, who I believe hasn't arrived yet, but we hope he will be here in time for his keynote with his team, and Dr. Jyoti Chabalal, who will also be speaking to us this morning. One of the things that we've been doing over the last year or so, sorry, I was thinking of people I want to welcome. I did want to say also welcome to Franz Kricker. It's wonderful to see you back with us, Franz. Looking very happy. You can tell people why, but I won't steal your thunder. Yeah, so one of the things we've been doing over the last 2 years is really trying to develop the research focus in Ekwanda. The research has always been there, always been a part of the Centre for Rural Health, but really a lot of energy has gone over the last number of years, since about 2010, 2011, in developing the Rural Clinical School, and now we're trying to make sure that we are giving equal emphasis to research. We have developed 4 research priorities in the centre that we are trying to focus our research around. Those priorities are rural health professions education, which is obvious in terms of the Rural Clinical School and what we do, and our association with the Centre for Health Professions Education is important in that. Collaborative care, how we work together as teams, multi-professional, across different disciplines, backgrounds, etc. That's an increasing emphasis in our work and in our research as well. The third area is rural child and family health. That's linked to our focus on the first 1,000 days, linked to some of the work that Amy is going to talk to later, but also very much a focus. And the last one is around clinical research in regional and district settings, because often what is done in the urban settings, in tertiary hospitals, needs to be adjusted, done differently, tested out in district and regional settings. So those are our 4 foci as the centre as we try to drive research. And as part of that, it's been wonderful to have the appointment of Dr. Amy Slowgrove. It's a joint appointment between pediatrics and Ekwanda through funding from the National Institutes of Health in a major research grant to help drive research here, and with her work bringing in others. And we're very pleased for the development of FAMCREW work here, and they've set up a clinical research site that Amy is leading on the grounds of Worcester Hospital. There's already a team working with Amy. We have the trust team working on TB that is also here, and we're looking to grow that. And as part of that, working very hard out there, she's not in here, is been very pleased that we were able to appoint an RRF research intern, Kopana Dube, who's out there registering people, and that's also a very important part of our research development. So that's an important thing going forward, and we look forward to further contributions and to invite you all to participate in the development of that. We really hope that these 4 focus areas will not be just focused on health, but that we'll become multi-sectoral in the way that we address all of these, because we see that health is not about health professionals or about medicine. It is about holistic understanding. It's a social endeavor, and that is what we want to do in our research as well. So I enjoy the day very much, and we'll see you throughout the day. I'll hand back to Lindsay.
I noticed the coffee wasn't strong enough, right? Okay, ladies and gentlemen, I just want to talk you through some housekeeping before we continue with the program. First of all, each one of you would have received a little folder. In that you have our program for the day. I am going to ask, especially the speakers of both the plenaries as well as the presentations, to please adhere to your time. We have timekeepers, and they do have the right to share with you how much time you have. So please note, when they indicate that you've only got 5 minutes, it's only 5 minutes. And then, if it's a minute, please wrap it up, because the next one will tell you to stop. We want to respect each other, and keeping time is one of those ways that we can show our appreciation. Each one of the sessions will have a chair, and they will introduce themselves to you. And if you have any questions, please feel free to ask any of our staff members for assistance. How many of you are visiting the main campus, Stellenbosch, for the very first time, just by show of hands? Man, we need to give you a round of applause. Well, because once you've been here, you'd be wondering, why haven't I been here before? And is there an office for me, is normally the next question. Yes, please, there is office space. So come and speak to me if you are interested in working in this wonderful creative environment. Right, Colleen is our timekeeper. Thank you, Colleen. And she's normally sitting right in front. The next thing is, yes, we do have Wi-Fi access, but we know that the sessions will be so interesting that you would not want to check your email. We ask also that you respect that. Good. In your little book, you would see a beautifully bright color book. And ladies and gentlemen, we could not have done this day without the generous sponsorship from Innovation World, including these books as well. So you can't miss them. I know a lot of the books look the same, so just write your name on it somewhere so that if it is lost and you have some notes, do so. In your little booklet, you have the evaluation form. If at any stage you need to leave, we would really appreciate, even if it's just a comment on the sessions that you were in, to please just fill it in and leave it at reception for us. And then, of course, a little bit more information of our center. For those of you that don't know, now I'm going to look like an air hostess. So ladies, to refresh, ladies and gentlemen, to refresh yourself, just go down the stairs, and to your left and around the corner, you are able to refresh yourself. but there are other facilities as well. And if you're not sure, please just ask one of our staff members. Craig is our photographer for the day. If you want a specific photograph to be taken with specific people, and you can get hold of him, please feel free to ask him. So ladies and gentlemen, thank you very much for getting up early for those of you that came from the other side of the mountain. A warm welcome to those of you that are from Worcester and surrounding areas, and I hope that you would enjoy the day with us. Right. So, now it gives me great pleasure to introduce our keynote speaker. So when I asked Nulda for a CV, I realized that her CV would be pages long, and to go through that is a plenary on its own. So she was able to condense it. And therefore, ladies and gentlemen, Nulda's been involved in research forever, for a very, very long time, particularly in the field of pediatrics. She then had a very checkered career, moving from pediatrics to pharmacology, and then had a whole tribe, her words, of children, and did a PhD while doing that. She worked in a proper research lab, and then she moved back to what she really loved. In actual fact, I would use the word passionate about, and that is working in communities with people. Although she's retired now, and at times she feels like she wants to return, at least to get some rest. This whole retirement business is not for her. Because Nulda is a mentor, a teacher, and a passionate person for the communities where she's had influence. Ladies and gentlemen, I want to welcome to the podium Professor Nulda Beyers.
Thank you, Lindsay. I actually said this retirement business is not for me. I want to go back to work so that I can rest a little bit. I'm far too busy with all the nice things that I am doing. Right on time, and you'll tell me when I have to stop. Thank you. So I just want to tell you a story, a personal story. And it's not, there isn't a right or a wrong, it is just a personal choice, how one chooses to do research, but also how one chooses to spend one's own life. Because research taught me about life, and life taught me about research. One can't separate these two things out. And in the end, now that I'm a really old woman and a retired person, in the end, one wonders, what was it all about? What is it that I want to leave behind? And that is for all you young people to think about while you slog away working really hard, to pause a little bit and think, what is this all about really? So I'm going to give you a few lessons that I learned about life through research. For me, the first really important lesson is the importance of mentors. And some of us need more than one mentor. I needed 3 mentors in my life. And this is the only picture I have of me with my 3 mentors. I needed, on the right-hand side, Don Enerson, who is the most magnificent clear thinker that I know, and he's also retired now. He's even older than I am, and he was world famous in the field of TB, and he was an excellent teacher. And life and research are circles, cycles. Don taught me, then Don and I, together in one of the last series of workshops we gave, we taught Amy, and now it is over to Amy to carry the circle forward. Then Paul Kluwer taught me about the big world out there, how one needs to strategize, how one doesn't live in a little bubble. And he tried to teach me to drink wine, but I was a useless student. I still can't drink wine. I can't smell the berries and the chocolate and the bitter. I mean, it's all like fairy tales to me. And then Father Desmond taught me two really important things. Whenever he has to give a talk, he arrives at least half an hour before the time, and he insists on having a room where he can sit. He says he prays, but I think he does what all of us do before we have to give a talk. We get our minds into the space of what we have to talk about. And the other lesson is, once a journalist asked him, because every day when he was still in office, between 12 and 2, he's not available. He's in his office, closes the door, and again, he prays. And then the journalist asked him, but if you take 2 hours out of your very busy life, how do you manage to do all the work you have to do? And he said, you don't understand. If I don't take those 2 hours out, I cannot do my work. And that's an important lesson for all of us, getting so involved in what we do that we don't balance our work with our life. So I was really lucky. My 3 mentors taught me a lot of stuff. Then another lesson, and sadly I learned it late in my life, is that one can do research anywhere. Like Amy, who went to Vancouver, we spent some time in Vancouver, and I worked in a laboratory. Because this was the late 80s, beginning 90s, when the idea was that research means laboratory, high-tech research. I wasn't that bad in the lab, but I hated it. I sat in front of a microscope, and I did electron microscopy. They put me in a little silent room with nobody to talk to. It was torture. I hated it. When we came back, I went to speak to the then dean and said, I don't want to carry on with laboratory research. I want to work in communities with people. And he said, don't waste your time in communities. If you want to do research, you must work in a lab. Well, that wasn't me. And then I thought a lot about how I got confused between what is primary health care, what is tertiary health care, which needs to be done in a tertiary institution. And then I made the jump that therefore academic work can only be done in a tertiary healthcare center. And that was pathetic thinking on my side, because it's stupid. Because research can be done anywhere. It can be done in a tertiary care center, it can be done on primary health care, and I love this quote, which says, all the world is a laboratory to the inquiring mind. And that is what one needs to develop, just a mind that questions things. And much later in my life, I realized that fancy technology can never fix a broken health system. And therefore, I'm profoundly proud of Ukwanda, of this research day, that you are changing the way people think about research, because some of the best research comes from rural areas, from primary health care, and quite frankly, that is what our country needs. So keep on the good work. Then we have choices. So I want to talk a bit about choices and coffee. not everyone wants to be a researcher, and that's fine. Some people are born researchers, and some people are born clinicians, and some people are born teachers, and we have to use the talents that we received. But even a good clinician must ask questions the whole time. And all of us do research every day of our lives, because if I go out to a coffee shop and I order a cup of coffee, then I think, this is a fabulous cup of coffee. And why can I say that? Because I compare it to a cup of coffee that I had last week in another restaurant or in another coffee shop. Or I say this is a pathetic cup of coffee because I compare it to what I've had before. And that's research. We compare one thing to another thing, and then we know what is the one we want. Right? So we all do research the whole day. Research isn't that difficult. And a good clinician, we go to the bedside, see a patient and say, something is different in this patient, what is it? And then read up and then improve the way one cares for patients. So we all do it the whole time. But then there was this article that said the importance of stupidity in scientific research. And to be a researcher, one actually needs quite a thick skin and not a big ego. In fact, one cannot have an ego if you are a really good researcher. This article tells the story of a very good scientist who met a friend who started with research as well early on, and then she dropped out of research, and he asked her why, and she said, because I felt so stupid every day, because I didn't know what I was doing, or I didn't know what people were asking me. And then he wrote this wonderful article saying, that's wonderful, you have to feel stupid so that you can read up and improve your knowledge and become a better researcher. Some people don't like being criticized, and that's fine, but then you're not going to last in research. In research, you must say, it is important to feel stupid, because that's the only way I can improve my skills and be better and become a better researcher. And then the coffee bit. Oh, no, I've talked about the coffee bit. Right, I want to talk about the cups. Is that, again, a story about a researcher who invited his students to come and have coffee in his office. And then he put out the cups, and there was a beautiful cup with flowers on, and a saucer, and a lovely mug with little animals on, and then a cup without a saucer, and then a cup that was chipped, and so on. So we poured them all coffee, and he said, well, each take a cup. So of course the nice cups went first, and then the student who ended with a broken cup, the cup with a big chip, he said, this is really unfair. I get this ugly cup with a chip out. And the professor said to him, but you're not keeping your eye on the ball. I invited you for coffee. The coffee in all the cups are exactly the same. Don't be distracted by outward things that have got nothing to do with the core business that you're busy with. And that's a lesson again in life and a lesson for research. Let's keep our eye on the ball. It's so easy to get waylaid and distracted. How do we do good research? Again, something that Don said to me, never put yourself in a position where you have to defend the quality of your data. You can defend your hypothesis, yes, but don't ever have to defend the quality of your data. Never compromise on that. And that one can only do if you have a good design for your research. And again, nice quotes, If you torture data sufficiently, it will confess to almost anything. So data is really important, and like as in the same way as data and the quality of data are important in research, we can think about life, what's important in life, and what are the things we are never going to compromise on. And everyone can think for him or herself, what are those things, and then stick to that. Right, then, life and research are divided more or less into thirds. And there's an end to research, and there comes an end to one's life. And there's this beautiful song by Chris de Burgh where he says, "For there will come a time when we'll be gone, gone without a trace." And that's so true. Even for really, really important people. If we take Mr. Mandela. When did he die? 3, 4 years ago? 5. And it's, yes, we all know about him, but he's not that presence with us every day anymore. And we need to think, what is it in the end of our life, or at the end of our research, what is it that we want to leave behind? Our life normally is divided into the first third, we live really for our parents. The second third, we live for our family, for our children. The last third is we live for ourselves. And I will talk a little bit about balance in life later, maybe, if I have time. But Rob actually said, I must use one of his quotes. He says, research, medicine will eat you up and spit you out and not even say thank you in the end. So, when one comes to the last third of one's life, if one hasn't developed other interests, then it's kind of really difficult to know what to do with my life now. Whereas Rob and I, that's why we say we want to go back to work, because we're so busy. We have so many other interests. And I feel sorry for all the young people here, because your life and your work life is so much more difficult and busier and faster than our lives have been. But just think that there is going to be that last third of your life, and make time for other things so that you can enjoy the last third of your life, which is the third that is there for you. And in research, I also think whether one writes an article, it's divided in thirds. Whether you do research, it's divided in thirds. So for research, about a third of time, you plan what you want to do. Remember to plan the data and the design well. About a third of the time is spent collecting all the data, and about a third spent completing, writing up the data. And then, if you now take your whole research life, you start as a junior researcher, then a midlife researcher when you do your most work, then a senior researcher, and then there comes an end. And what do you want to leave behind? Again, these are personal choices. Do you want to leave behind 500 articles written? Do you want to leave behind wonderful students trained, like Amy, who can take the work forward? Do you want to leave behind good relationships with Department of Health, because that is what you try to do during your research? Do you want to leave behind an example of treating people with respect, whether they're poor, whether they're people in Department of Health, whether they're colleagues? What is it one wants to leave behind? So think a little bit about the thirds, because this is a lesson I wish I knew that early in my life, that actually my life will come to an end and my work life will come to an end. Right. Then a lesson of starting small. Now this isn't small, this is in the end, it's big. And this was one research team that we took up Table Mountain. We started with 3 people. Myself, Rob, who happens to be my husband, and 1 research nurse. That's how we started. And we did a lot of work in childhood TB when it wasn't in vogue in the middle 80s. Nobody talked about childhood TB. And again, it was Rob, myself, and Prof Simon Scarf. And we always joked, we went to conferences, and then we would just rotate. I would be the speaker, Rob would be the chairperson, and Simon was the audience. And for the next talk, we switched around because nobody cared about children with TB. So we started really small. And again, my mentor, Don Enerson, gave us a roadmap how to develop childhood TB, how to get it onto the map, forming a working group, getting awareness, getting some stuff in the newspapers, then slowly working up to WHO level. And now childhood TB isn't an orphan disease anymore, but we started small. So don't aim too big. And also I think most of the people in the audience are really still young. And sometimes young researchers think their first article must be a New England Journal article. No, forget it. Start small. Go for the local journals, the South African Medical Journal. There's I just heard the HIV Journal, whatever its name is, the South African HIV Society Journal is now accredited. Wonderful. That's where you want your first articles written, and then slowly build up. And the thing for me that's I think the most difficult to do in research is collaboration. Collaboration is, how do I say, is gesetel in, is based on really having respect for each other, working as equal partners, and that's really difficult, but we have to do that with other researchers, with departments of health, on all levels, based on respect. Now we work in big collaborative networks, and it's difficult because there are different countries, people see the same problem from a different aspect, and I think if one has to jump into a big collaboration like that, right in the beginning it must be really difficult. So again, start small. Whatever research you do, make sure you collaborate with the local Department of Health, with your colleagues, etc. Then it's easy to build up. Right, then there are ups and downs. Now, I'm not sure you can read all of this, but it is, and this I use it with permission from Prof Harburg from Ann Arbor University. And it's the island of research, where one goes from total confusion, up a mountain, down in the valley, down in the deep dumps. And Dr. Phillips just showed me an iceberg just now, where the top that sticks out is the success, but nobody sees all the hardships that go on below. So it is there, like life. There are ups and there are downs, and you just have to find a way to get out of the dumps and see the good bits on the ups again. Then for me, and as I say, these are personal views, it's not rights or wrongs. For me, it was really important to get out of my comfort zone. In the late or mid-80s, up to 94, South Africa was incredibly isolated. And we only knew what we saw. And it took a long time for us, and I have to confess, and I'm totally embarrassed by it, that I went through my school career never questioning why the school that I went to only had white kids in it. It never crossed my mind, because I was born in the 50s. So I often wonder, why is it that that never crossed my mind? Because eventually when the penny dropped, boy oh boy, did I fight then. But it took a long time. And then when I was a young doctor, I wanted to start doing research. But again, I only knew what I saw around me. In Tygerberg Hospital, well, we still trained at Karl Bremer Hospital, and then Tygerberg Hospital, that was my reference framework. So we then went to Vancouver, and interestingly, Amy was also in Vancouver later, and we worked there for just over 2 years. Best thing we've ever done, because to get out of one's comfort zone, one learns that there are different ways of doing things. One sees that what one has in one's own country, it's not all good, but one also realizes that what one has in one's own country, there are good things. It's not all bad. And one realizes that in other countries, there are good things that one must adopt and bring back. But there are not such good things that one doesn't want to bring back. And the same, we always say, going to a lecture or to a series of lectures, goeie genade, sometimes one sits and is like, this was not really a rubbish talk. But learn something from it. Learn every day. What do you take away to use, either in your research or in your personal life? And what do you observe that you say, that I do not want to take back, not into my personal life and not into my research. So, get out of one's comfort zone and see different things. And then I think this is the last kind of lesson I have, and I think this, again, is really difficult, that to be a good researcher, again, this is just my opinion and things that I've learned, and the same in life, sometimes one must have tunnel vision and be really focused and get something done and not be distracted, like the story of the cups, not be distracted, focus on that coffee. But at the same time, one must have an open view, realizing that the research that we do, the life that we live, is not isolated from the rest of the health system, from the rest of the world. And it's very easy to get distracted. Representation of authors. Low-income countries where the research is done, how many authors from low-income countries and how many authors from higher? For me, that was important. We tried to change it. I was editor of a journal for a while, and we put a strategy in place by training authors and researchers in low-income countries so that there can be authors on papers. And this is being followed up now, and this is changing. Rob showed me this article published in 5th of May 2018. Guess where the discrepancy is now? In gender. So, I'm on my way out. You are the young ones. What do you want to change? And part of the reason that there's such a gender disparity is exactly the same as with the North-South disparity. It starts with the editorial boards. Editorial boards are mostly male. Researchers are mostly male. So, but the women do the work. So, anyhow, I won't say much more than that, but it is what is it apart from that tunnel vision that one must have while doing research, realizing it sits in a bigger academic frame? What is it you guys want to change? But also in the bigger world. Because what happens in the world influences what happens in research. One cannot separate these two. And like when I was at school and didn't see it was wrong that there were only white kids in my school, what are the things happening now that we don't see? Is it poverty? Is it inequality? Is it disparity in health? I don't know. But the future is yours. It's for you to decide what is right, what is wrong for you, what are your choices, and build on that and decide, realize your life, your research will come to an end. What is it you want to leave behind? Thank you very much.
Ladies and gentlemen, this is the opportunity of just asking Nulda some questions.
I'm over my time.
But you've still got 3 minutes, don't worry, she didn't say stop yet. So, ladies and gentlemen, any questions for Nulda? Use this opportunity now. Questions? Going? Yes, yes.
Nulda, thank you very much. That was wonderful, more than I hoped for. The importance of mentors that you started with, maybe make a comment on how one finds mentors, how one gets mentors. For young people, you know, it's maybe threatening to approach people or whatever. Do you have any tips on that?
I think a lot of luck is involved, meeting the right people, but thinking what it is one needs, and then not to be too timid. I yet have to meet the person, any person, but specifically an older person. If an older can be 10 years old. I haven't seen a 10-year-old child if the 5-year-old says, "Can you please help me?" That's human nature. People love to be asked by somebody else, "Can you please help me?" So not to go to somebody and say, "You must be my mentor," but most people, if one starts a relationship and then people like it if you say, if any of these young people come to you, Ian, and say, "I'm stuck, can you help me?" Will you say no? I don't think so. People will say yes. But it is for the young people to identify, because it doesn't help having, in my view, having a technically superb mentor, but you just can't build a relationship. It is about relationships. And in my view, people say yes. So go ask Dr. Amy. She will be a wonderful mentor. Any one of you, go ask her. She won't say no.